हेलो फ्रेंड्स, आज चैप्टर 17 एस्टिमेशन ऑफ क्रिएटिनिन क्लियरेंस देखेंगे। चलिए शुरू करते हैं। क्लियरेंस इज अ theoretical concept defined as that volume of plasma or serum from which a measured amount of substance could be completely eliminated into the urine per unit time। क्लियरेंस जो है एक थियोरेटिकल कंसेप्ट है, जिसको कैसे डिफाइन करते हैं तो वॉल्यूम ऑफ प्लाज्मा और सीरम फ्रॉम विच या मेजर्ड अमाउंट ऑफ सब्सटेंस कुड बी completely eliminated into the urine per unit time। Creatinine clearance is that volume of serum calculated to contain the amount of creatinine excreted in urine in 1 minute। Creatinine is a endogenous product which is formed spontaneously from creatine of muscle at almost constant rate in a given condition. That is why its level in serum is nearly constant from day to day। Blood while passing through kidney is filtered in glomerulus। The amount of filtrate formed per minute is known as glomerular filtration rate, GFR। Any substance in blood which is filtered in glomerulus but is not absorbed by tubules nor secreted by tubules is an ideal substance to determine GFR। ओके, तो क्या एनी सब्सटेंस जो है ब्लड में है, इन ब्लड विच इज फिल्टर्ड इन ग्लोमेरुलस बट इज नॉट एब्जॉर्ब्ड बाय ट्यूब्यूल्स नॉर सिक्रेटेड बाय ट्यूब्यूल्स इज एन आइडियल सब्सटेंस टू डिटरमाइन GFR। मैकेनिज्म, रिजल्ट, एग्जाम्पल। मैकेनिज्म 1, substance filtered, neither reabsorbed nor excreted, GFR clearance insulin। 2, substances filtered, reabsorbed and excreted, GFR is equal to clearance uric acid। 3, substances filtered, partially reabsorbed, clearance less than GFR slightly, urea। 4, substance filtered, partially secreted, clearance less than GFR slightly, creatinine। 5th, substance filtered, secreted but not reabsorbed, clearance more than GFR, diodrust pH। Generally, okay, creatinine is nearly such a substance, although it is also minimally excreted by renal tubule and is also partially reabsorbed by tubules। Creatinine clearance gives very good approximation of GFR estimation। Insulin is a better alternative for GFR estimation because it is filtered completely in glomerulus and is neither reabsorbed nor excreted by tubules, but the main disadvantage is that it has to be injected। For creatinine clearance test, ask the subject to pass urine completely at the start of the test and call it 0 hour, but do not save it। Now ask the person to drink a glass of water at 1 hour, collect blood for creatinine determination। At 2 hour, the person is asked to pass urine completely in a container and save it for creatinine determination। Incomplete evacuation either in the beginning or at 2 hours will give inaccurate results. Incomplete evacuation either in the beginning or at 2 hours will give inaccurate result. Now measure the volume of urine and calculate urine output per minute is equal to V ml. Measure creatinine concentration of urine U mg per 100 ml. Measure creatinine concentration in serum P mg per 100. Creatinine clearance is equal to U by P into V ml. Creatinine clearance is proportional to the body surface area. Therefore, this clearance value has to be recalculated after determining person's body surface area and expressed for 1.73 square meter. Creatinine clearance decreases in kidney disease and is done to know the severity of kidney disease and to monitor treatment. What is GFR? Question answer. GFR or glomerular filtration rate is the calculated value of volume of blood which contains the amount of substance, say creatinine, in the urine passed in 1 minute. GFR or glomerular filtration rate is the calculated value of volume of blood which contains the amount of substance, say creatinine, in the urine passed in 1 minute. Does creatinine clearance give true GFR? If not, what other substances gives true GFR value? No, it gives lower value of GFR because it is partially also reabsorbed by tubules. Insulin gives near true GFR because it is fully filtered in glomerulus and is not secreted by tubules. What do we know from creatinine clearance test? Creatinine clearance test is performed to understand the severity of disease of kidney. What is normal range of creatinine clearance? Normal range in males is 95 to 140 ml per minute per 1.73 square meter, and in female it ranges between 85 to 130 ml per minute per square meter. What is eGFR and why is it useful? eGFR stands for estimated glomerular filtration rate. Calculation of creatinine clearance has become the standard laboratory method to determine GFR. Okay. Question number 4, what is the normal range of creatinine clearance? तो normal range और in male जो है 95 to 140 ml per minute per 1.73 square meter, and in female it ranges between 85 to 130 ml per minute per square meter. What is the eGFR and why is it useful? Question number 5. Answer. eGFR stands for estimated glomerular filtration rate. Calculation of creatinine clearance has become the standard laboratory method to determine GFR. Calculation of creatinine clearance has become the standard laboratory method to determine GFR. For this, we need to collect the exact 24-hour urine sample and also blood for serum creatinine testing at The halfway time getting an accurate GFR level is challenging. Inaccurate results caused by incomplete blender inputting, failure to collect the entire specimen impairs the usefulness of this procedure. It is for this reason that physicians started to use formulas to estimate creatinine clearance from the serum creatinine concentration, thereby bypassing the need for urine collection. The equation is based on serum creatinine, age, body size, gender, and race without the need of a urine creatinine. CKD does not have any symptom until the later stages of the disease. This is the reason why reliable estimates of GFR are so important for identifying CKD as early as possible. Over the year, different formulas were developed to calculate the GFR. The simplest and most widely used for many years was the formula described by Crooncroft and Gault. It also had its limitation and subsequently MD-RD formulas for estimation of eGFR and CKD EPI formula. All these formulas took into consideration the sex, age, and race of the individuals and was a boon for the timely identification of renal डैमेज। नेक्स्ट चैप्टर है 18, इसे हम लोग नेक्स्ट वीडियो में कवर करेंगे, एस्टिमेशन ऑफ सीरम यूरिया। थैंक यू, बाय बाय। पढ़ते रहिए, मुस्कुराते रहिए। ओके बाय।